Surrogacy is a fascinating and often life-changing arrangement. It's when a woman agrees to carry and give birth to a baby of another person or couple known as the intended parents. Hi, I'm Dr. Priyanka Mathur, international physician for 15 plus years and founder and CEO of multiple global healthcare companies and surrogacy agency. Today, we'll break down everything intended parents should know about surrogacy in 2025, focusing on the latest legal and medical progress, dispelling myths, and sharing empathetic insights. Now, think of surrogacy as a remarkable collaboration to create a family when the intended parents are unable to conceive or carry a pregnancy themselves. This pathway to parenthood has two main types. Gestational surrogacy, most common. Now, this type is less complicated legally and emotionally because the women carrying the baby, the gestational carrier or surrogate, has no genetic connection to the child. How is it done? An embryo is created using in vitro fertilization, IVF. This involves fertilizing the egg of the intended mother or an egg donor with the sperm of the intended father or a sperm donor in a lab. This embryo is then transferred into the gestational carrier's uterus and she carries the baby to term. This method reduces legal complication and is increasingly preferred worldwide. And the other type is the traditional surrogacy. Now, in this less common arrangement, the surrogate is the biological mother of the child because her own egg is fertilized by intended father's sperm, usually through artificial insemination. Now, after the birth, she legally gives up her parental rights to the intended parents. Let's talk about legal landscape and global surrogacy laws. Legal framework for surrogacy vary dramatically across countries and even states in the United States. Around a third of US states have personhood laws granting rights to fetus, affecting IVF and surrogacy regulations by introducing complexities around embryo status and parental rights. Globally, some countries have embraced surrogacy with legal protections for all parties, while others maintain bans or restrictions, creating a complex international landscape for cross-border surrogacy arrangements. The tech revolution in surrogacy is interesting. Now, surrogacy isn't just a legal or personal journey anymore. It's a high-tech success story driven by medical breakthroughs that have made the dream of parenthood more achievable than ever before. Think of the modern fertility clinic as a high-precision laboratory where success rates are climbing thanks to incredible sophistication. Smarter embryo selection. Today's IVF techniques aren't just about fertilization, they're about selection. We use pre-implantation genetic testing, PGT, to screen embryos for genetic disorders before implantation. This is a game changer that significantly reduces the risk of miscarriage and ensures we're choosing the absolute healthiest embryos. Now, the power of AI in some clinics, the selection process is even guided by artificial intelligence. These tools can analyze subtle visual cues in an embryo's development to predict its viability, essentially giving doctors a powerful new lens to maximize the chance of successful pregnancy. Now, once the surrogate is pregnant, technology shifts from lab to her everyday life, focusing on safety and seamless communication. Now, 24/7 health monitoring. The era of basic checkups is over. Surrogates can now benefit from wearable health monitoring devices. These gadgets provide medical teams with real-time data on vital signs, enabling the early identification and management of any potential pregnancy complications. It's like having a digital guardian angel. Bridging the distance with telemedicine. The global nature of surrogacy demands flexibility. Telemedicine has answered that call, revolutionizing patient-provider communication. It allows intended parents and surrogates to stay deeply connected to their medical team through virtual check-ins, consultations, and support, regardless of which side of the world they are on. Even the logistics of surrogacy are becoming modernized for privacy and better outcomes. Securing sensitive data for processes like international surrogacy, where data crosses borders, blockchain technology is emerging as a critical tool. It ensures secure patient data management, guaranteeing the privacy and integrity of a highly sensitive information. Smarter matching algorithms, the initial search for the right surrogate is also being transformed. Digital platforms now use detailed databases and algorithms that go beyond simple medical history. They consider personality, lifestyle, and specific preferences to create a truly compatible pairing, leading to a smoother and more successful journey for everyone involved. While technology provides the pathway, the ethical, financial, and legal structures are what keep the surrogacy journey grounded and reasonable. This is where the truly complex and important conversations are happening. At the heart of surrogacy are critical human rights and welfare issues. The industry's future hinges on getting these right. Autonomy versus exploitation. The central tension ensuring the surrogate's autonomy, her right to make decisions about her body and the pregnancy, while fiercely guarding against exploitation, especially in commercial surrogacy arrangement. The biggest concern, the risk of commodification of women's body, a framework for fairness. Now, to address this, ethical practices now demand more than just a signature on a contract. They emphasize robust, informed consent, mandatory psychological support, and fair compensation that truly recognizes the surrogate's crucial role. The goal is to establish legal protections that equally balances the interests of the surrogate, the intended parents, and most importantly, the rights and welfare of the child. The journey to parenthood via surrogacy is major financial undertaking, but it's also breaking down social barriers. The sticker shock. The sheer cost of surrogacy remains a significant hurdle, often starting at $150,000 in the United States. Now, this hefty sum covers everything from advanced medical procedures and legal fees to compensation the surrogate for her time and commitment. The changing face of family. Now, the good news is that the legal and social landscape is becoming more inclusive. Surrogacy is rapidly becoming an accessible option for LGBTQ plus couples and single parents as the legal protections expand. While the stigma persists in some communities, growing social acceptance and awareness are steadily normalizing these diverse family structures. The surrogacy industry is constantly evolving with new trends pointing toward a faster, safer, and more accessible future. Now, speeding up the start, thanks to digital innovation and streamlined operation, the time it takes to match an intended parent with surrogate is shrinking. Especially with Medi Pocket Surrogacy USA, we have the fastest matching within 10 days after a successful boarding of an intended parent. Now, this is a massive improvement, allowing families to start their journey much faster than before. Pioneering technology with leading clinics like the hypothetical Silk Medical are continuously integrating cutting-edge technologies to refine genetic screening and IVF success rates, promising healthier embryos and safer pregnancies. If you are an intended parent starting a surrogacy journey tomorrow, which factor would give you the most peace of mind? The advanced AI technology, choosing the healthiest embryo, or the comprehensive legal contract, ensuring the protection and fair treatment of your surrogate? Let me know your thoughts in the comment section.